And then I'm going to invite Professor Alastair McEwan up now to introduce Dr. Lynham. Thank you.
Well, thank you, Jason. I too would like to acknowledge the traditional owners of the land on which we gather and meet and pay respects to elders past and present. The Honourable Dr. Anthony Lynham MP, Minister of State, Development and Minister for Natural Resources and Mines, Professor Jason Roberts, Director CRE REDUCE and Centre staff, UQ colleagues, distinguished guests, ladies and gentlemen. Good morning, everyone, and thank you to Jason for outlining the vision and research plans for this wonderful new centre for research excellence in redefining antimicrobial use to reduce resistance. And I'd certainly like to congratulate him on this. I'm very pleased to be here representing the Vice-Chancellor at this launch of this new centre, which is certainly of great interest to me personally and professionally as a microbiologist. And it certainly opens up a wonderful new front, I think, in the global fight against antimicrobial resistance and certainly its management and reduction. What a fight we have on our hands. Jason's already articulated a number of challenges, but I thought it might be worthwhile just to remind you about the magnitude of the challenge. We see that 170 plus Australians die of these acquired infections every week. More than 175,000 healthcare-acquired cases are admitted to Australian hospitals annually. The list could go on. This is costing the Australian economy an estimated $1 billion a year. And of course, there's a huge problem that needs to be addressed. If left unchecked, Jason's already mentioned, superbugs will kill more people than cancer by 2050. So from UQ's perspective, we believe this challenge is best addressed by a joint response from government, research providers, and health services. CRE REDUCE fits nicely into this model of collaboration. It's funded, as we mentioned, by the NHMRC through a $2.1 million grant, bringing together a variety of researchers, clinicians, nurses, pharmacists, biostatisticians, intensive care specialists, and transplant physicians. So it's a real diverse team which you need to address such a problem, working together to manage these doses of antimicrobials to avoid the development of antimicrobial resistance. So CRE, as Jason mentioned, is about optimizing the use of antimicrobials we already know about in order to prolong their efficacy. So this is leading to international and national studies determining the best dosage, and this will have a real impact on the treatment of critically ill children, patients in burns units, post-transplant, dialysis, and intensive care units, who are likely to fail treatments and have resistant superbugs emerge. I think importantly, of course, there's that educational dimension. So educating organizations and individuals in order to prevent suboptimal antimicrobial use, as well as finding new ways to treat, will also have a real impact, I think, on our community and our society. So I think that educational dimension also continues into training the next generation, this translating patient-focused research into clinical practice based on rigorous improved patient care, leading to the training of 15 PhD students, 5 research assistants, postdoctoral fellows, and a large number of clinical interns as well as undergraduate research as well. So a real impact, I think, on the education and training across the healthcare sector. So the work more generally of CRE REDUCE dovetails nicely with UQ's aims in this whole area of collaborating to fight superbugs and infectious diseases more generally. And I'd just like to mention that we have a huge effort in this area. The Australian Infectious Diseases Research Centre is a collaborative program between UQ and QIMR, and this brings together 80 research groups across the biomedical and clinical sciences, focusing on the development of new therapies, diagnostics, and treatments with real clinical and public health impact as part of that aim. So in terms of Jameson's own research in the CRE REDUCE, I'd just like to mention that this is actually a very strong collaboration with the Burns and Trauma Critical Care Research Centre, which is part of this facilitation of research programs and international collaborations. And I'd certainly like to mention his interaction with Professors Patterson, Chembry, and Lippmann, collaborating across a variety of schools, across 3 sites, I should mention, across the Herston, across the river, and also down in St. Lucia. So that's a real example of collaboration, I think, and I think that's the way that we can have real impact into the future. So the translation and structure and strategy of CRE REDUCE can leverage these existing collaborations to ensure that the global aims of superbug emergence are restricted and in fact reduced. So I look forward to hearing the outcomes of your work in the future years.